Okay, so the next one is nicotine replacement therapy. 所以这个就是用来这个做这个戒烟的这个治疗，使用尼古丁，不管是贴片或者是口服的或者是各种不同的方法。Nicotine replacement therapy, we call it NRT. Okay. So the first one is the case. A customer come in, asks you for help to quit smoking. And this customer has been trying for so many times, but all fail. So how can pharmacists help him? Okay, so yeah, the first we still have asked the question, are they taking any other medication? Right? Because some medication might interact with nicotine. Are they pregnant or they breastfeeding? Or how many cigarettes they smoke? Is it 10? Less than 10 or more than 10? Okay. I will explain why we ask those questions later. And do they have asthma or diabetes? Or do they have any heart problem? Or they have peptic ulcer, any stomach issue, or any medical condition? Or do they have sore throat or inflammation in the mouth? Or do they have any denture or any denture surgery lately? Yeah. So 为什么要问这些问题？所以我们等一下会一一的解释啊，因为这些都如果有病人，我想在台湾也有这种所谓的戒烟的药师的，好像药局有些药局可以做这个服务，这个 service。Okay. So for the smoke, if you want to quit smoke, normally there's a stage. Yeah. So the first stage for the patient, we call it pre-contemplation. So that stage is before the second stage is called contemplation. Contemplation 所以说 contemplation 这个是好像是说 pre-contemplation just say I'm not ready to quit smoking yet. So you have to find out what stage is this patient in. We have to make sure make sure which stage is the patient now is in. 我们要知道他现在是在哪一个阶段，然后我们采取不同的这些步骤啊，看他是属于 pre-contemplation 还是 contemplation 啊。So if the patient is in stage 2, then normally when you ask question and he will say, "Oh, I know that my problem, I should quit, but I'm not sure how to do it yet." Then you know this is stage 2. And the third step is preparation. Yeah. Patient sort of I'm ready. I'm ready. I have cut down the number of cigarettes, but I still smoke per day. Okay, that's preparation. And then action is I'm ready to quit smoke now. And maintenance. So once they start they're doing something or treatment, they already say, "Oh, I had quit the smoking," but they quit the smoking, there's still a very high possibility or chance they might come back to get smoke, to pick up smoking again. So we call it stage 5. So we have to find out which stage is this patient fall in which category. Yeah. Like, for example, if the patient is still in stage 1, I'm not ready to quit. So in this stage, you just have to help them to move on to the next step. 如果这个病人你认为他是说哦我还没有准备，但是这个时候我们作为药师，我们可以怎么样帮助他进入到下一个 step 啊？那if you realize this patient in stage 2, so your job is help them is to move from stage 2 to stage 3. Yeah. So the first you have to find out which stage the patient is in. Okay. So why MRT? Because MRT can double the chance of quick smoke. And normally for the nicotine, the pregnancy category is D. So which means any pregnant woman, we can't do NRT for them. We have to try something else. And also for nicotine, because it's metabolized through cytochrome P451A2. So this is an enzyme in the liver. So any medication using this enzyme will interact with this treatment or people smoke. And also, nicotine is an enzyme inducer of CYP1A2。所以说尼古丁这个东西是它可以诱发这个 CYP1A2 这个酵素的生成。所以说它会让很多药物如果是透过 if some medication they are breakdown through CYP1A2, that means if you are smoking or using nicotine replacement therapy, that can reduce the effectiveness for that drug. Okay, so cytochrome P450 enzyme， 所以这个就是我们肝脏里面的酵素的一个分类，我们一般都是把它叫做 CYP2C9。Have you learned this system before? I want to ask this question. 你们在学校里面有没有学过这个 CYP 什么什么3A4? Have you ever come across this enzyme? 有吗？
有上过。
Okay, 好。Sabir, have you ever come across this enzyme in the school?
No, Professor. I don't know.
Okay. In that case, just Google this one. CYP is a system like to categorize the enzyme to break down the medication. This is very important for pharmacists. When you look at the which drug will interact with some different drug, you have to very familiar with this system. Okay, so CYP40 enzyme is essential for the metabolism for many medication, and more than 50 enzyme, but only 6 of them, the enzyme they metabolize 90% of drug. 所以虽然说这个系统里面有多达50种的这个酵素，可是最主要的是只有6个。那这6个呢，一般就是有90%的药都是透过这个药物这个肝脏的这个系统来代谢。And also only 2 are the most significant, which is CYP3A4 or CYP2D6. OK， 所以这2个酵素是最重要的。所以说有50个50 enzyme, only those 2 are the most important. Okay, but which one digests the nicotine, which is CYP1A2? Okay. Okay, so remember the question we asked the patient, are you taking any medicine? Yeah, because some medication can interact with this nicotine, or people stop using cigarette. Yeah, antipsychotic, benzodiazepine, or beta blocker insulin, fluvoxamine. Yeah, so 这个你们可以自己看一下。There's a drug interaction when people they smoke or they stop smoking. Yeah. And asthma, diabetes, heart problem. Why this one important? Yeah. Okay. The reason that we ask whether they have heart problem because the nicotine can shrink the blood vessel in the body. So when people they smoke, they tend to have heart issue like angina, or if they have peptic ulcer, because nicotine can irritate the stomach. 这个尼古丁它会刺激我们的胃，所以说如果它有这个消化性的溃疡的话，它使用这个尼古丁的这个口服的话，可能就会刺激让它不舒服。那当然，如果 asthma 当然不用讲，那个，如果你用它会让 asthma 有时候会更严重，或者是也请说
看不到 PPT。
什么东西 PPT。
对，就是我们老师现在没有分享那个 PPT 的画面。
哦，不好意思，sorry about that。你们从哪里就没有？从一开始就没有吗？
前面有，是刚刚老师讲到那个阿斯玛那边没有。
哦，这样子，OK，我是按到什么？所以是 How about this one？这个有吗？Taking any other medication？
这里没有。
那这个呢？CYP P40 P450这个。How about this one? The pregnancy category？
这个有，这个有。
哦，这个有，OK。那这个呢，就是说50 enzyme, but only two are most important or significant, which is CYP23A4, CYP2D6。这个有吗
有，这个有。
？Okay, so next one, you're taking
这
any
个
other？这个有没有？
没有，刚刚
哦，
没
这个没有。
看到。
Okay. Yeah, so some antipsychotic, yeah, like uh chlorpromazine, haloperidol, or clozapine. Yeah, because um, when people on those medication, they probably need to reduce the dose because when they stop smoking, yeah, those enzyme, um, because nicotine is that the enzyme inducer, right? 我们刚刚前面讲到说这个，yeah, nicotine is a CYP1A2 inducer. So when you using cigarette or you use nicotine, in your body will have a lot of CYP1A4. So which means any drug using this pathway, you need to increase the dose, right? Because the smoking induce your body to produce a lot of enzyme to digest to break down the medication. But for people using antipsychotic for those medication, once you stop smoking, then which means those enzymes will be reduced. And that means the medication you are taking now, it will go up in your system. So that's why when people stop to quit smoking, then sometimes they need to consider to reduce the dose. Yeah, can you understand? 这样了解吗
Yes, professor.
？Okay. Yeah. So you have to work out those drug interaction because because some like nicotine can interact with a lot of medication. Some maybe have to reduce the dose. Some may to have to increase the dose. You have to figure it out yourself. Okay. Yeah. So for those questions, we have to find out if they have unstable angina, they probably not nicotine replacement NRT probably not suitable for them because the nicotine can shrink your blood vessel，它会让你的这个尼古丁会让你的血管呢缩小，所以说他们的这个心绞痛这些问题如果不是很稳定的话，可能使用这个尼古丁的这些产品并不适合。Or the recent heart attack, yeah, probably not a good idea. Or even they have arrhythmia, cardiac arrhythmia. Okay. So that's the nicotine patches on the market. So normally they have 3 steps. Step 1, step 2, and step 3. So they will start from step 1. Normally it's a higher strength nicotine. So it's 21 milligram. And step 2 is 14 milligram nicotine. And step 3 is 7 milligram. 所以刚开始戒烟的时候，我们用比较when they first start stop or quit smoking, we use the highest strength nicotine patches, and then when the step go up, the dose reduce. And this is nicotine gum. So you have patches. People don't want a patch. They use like gum. It's like a chewing gum. And how you use it? You choose the gum and rest between your cheek and gum. 就是说你把它这个口香糖咬一咬，然后 when you chew the gum in your mouth, you'll feel the stinging. When you feel the stinging, that means nicotine is coming out. And then you put the gum between the cheek and gum, and that way will help the nicotine to go to your system, your body, and reduce the process for up to 30 minutes. 所以当你使用这个口香糖，你一直在咬，然后咬久了，你放在你的那个嘴巴，可能放个几分钟，然后你就重复这个步骤，不断的去咬，然后再把它 you put it aside，就是放到你的嘴巴了，然后重复30分钟。Yeah. 那这一个口香糖就像是好像对他们说就是吸一根烟。Yeah. Okay, and there are so many other products like spray. So nicotine spray. 这个喷剂你就是把它喷在你的嘴巴里面，然后喷一次或者是所谓的 inhaler，就是好像这个 cartridge 就是里面就是那个 nicotine，the cartridge inside is nicotine. So you put it in an inhaler and just like do it like smoke. You smoke those nicotine into your system. And also there's a lozenge. 它做成这种喉糖的形式。So there are so many different type of nicotine the patient can select from the pharmacy. Then, how do you choose the right product? How do you choose it? So remember the question you asked: how many cigarettes they smoke? Normally, we use the 10 cigarette as a criteria. If they have to smoke 10 cigarette a day, more than 10 cigarette a day, we start from step 1. If they smoke less than 10 cigarette, we use a step 2. Okay. Then normally when you start from step 1, you stay there for about 1 or 2 months. Then when this is ready, they can move to step 2 and then step 3. Yeah. So the 10 cigarette is the question you ask. Do you smoke 10 cigarette? Yeah. How many do you it's more than 10 or less than 10? But different product, they have different question. Yeah. Like recommend like nicotine gum, they use 20. Yeah. If they use gum, you just have to ask them, do you smoke 20 or less? Yeah. If they smoke 20 cigarette, you use the higher strength, which is 4 milligram nicotine. And less than 20, you use the 2 milligram one. Okay. Okay. So any question for today?
还是我想请问说，就是老师刚刚有说那个尼古丁的产品啊，是看说一天你抽几根烟，然后下去做选择，说你要哪一个比较适合你。但如果大家抽的烟的那个品牌不一样，它的尼古丁那个香烟本身尼古丁的含量会不会有不同？
Okay. So I think the question for 10 cigarette and 20 cigarette, and also some product, they will change the approach to ask the question. They will ask you, do you feel when you wake up in the morning in half an hour, do you normally have your first cigarette? Yeah. 因为有一些厂牌他们会说你醒来的30分钟内会不会开始点你的第一根烟？如果会的话，就是表示它是烟瘾比较重的。So the question, it doesn't matter it's 10 or 20. We just want to figure it out. Is the patient is heavy user or light user? Yeah, so those questions just help you to determine if the patient is a heavy user or light user. So it doesn't matter it's 10 or 20. So if you can sense this patient they've been on smoke for a long time, yeah, and you probably can just put them in a heavy user. And if the patient only smoke, it doesn't matter which brand, yeah, 它跟哪个品牌，它香烟它抽，有时候不是有很大的关系。这个问题只是在决定说它是属于重度使用还是轻度使用。所以你从你跟他交谈的经验，你大概可以了解，你可以问多一点问题就是刚刚说的这个问题，一天抽几次啦，或者是说抽几包，或者是说你早上醒来30分钟内会不会点你的第一根烟？如果会，通常都是重度使用，或者说比较严重那这个时候你就可以从那个比较高剂量开始，这样。
好，谢谢老师。
Okay, understand? Yeah, I think those questions just want to find out if are they a heavy user or just a light user. That's all. Yeah. And then for heavy user, we use the higher dose, and the less cigarette they use, then we use the lower dose. Yeah. Okay, we finished the lecture today, and I think last week will be our last lecture. Yeah. So we'll just see you next